Hello guys, this is Indian Medico, and in this video we'll see a review of microbiology. First let us discuss about general microbiology. First let us see about various diagnostic methods. The various methods to identify a pathogen include microscopic examination. For this we can use various stains like Gram stain, acid fast stain, Wright stain, KOH mount, India ink stain, Gomori methenamine silver stain, and Zhang smear. Other methods include growth or biochemical characteristics in culture, immunologic techniques to identify antigens or antibodies, and DNA probes. Now let us see about Gram stain. Crystal violet binds to cell wall after treatment with a weak iodine solution. Some bacteria retain the crystal violet even after a decolorizer is added. These bacteria are called gram-positive bacteria and they stain purple. This picture shows gram-positive bacteria. The bacteria with a high lipid content lose the purple color and pick up the counter stain, that is safranin. These bacteria are gram-negative bacteria and they stain pink. This picture shows gram-negative bacteria. Now let us see about acid fast stain. Mycobacteria have a high lipid and wax content in the cell wall that resists staining, but once stained it is not decolorized even by acid alcohol. Acid fast organisms are red against a blue-green background. This picture shows acid fast Mycobacterium tuberculosis. There are two methods for acid fast staining. They are Zeal-Nielsen method and Kinyan method. In Zeal-Nielsen method, heat is used to pre-treat the organisms so the primary stain can penetrate the cell wall. Kinyan method is a cold method in which detergent is used to pre-treat the organisms. Now let us see about Wright stain. It is used to identify white blood cells in stool wet mount. This picture shows neutrophils stained with Wright stain. Now let us see about potassium hydroxide preparation. It is used to identify candida or other fungal elements. This picture shows potassium hydroxide preparation, low magnification of hyphae, and this is high magnification showing fungal hyphae and arthroconidia. Now let us see about India ink stain. Centrifuge of CSF with a drop of India ink on a slide is used to identify the capsule of Cryptococcus neoformans. This picture shows India ink stain of Cryptococcus neoformans demonstrating capsule. Now let us see about Gomori methenamine silver stain. It is used to identify Pneumocystis jirovecii and fungi. This picture shows numerous spores and hyphae in Gomori methenamine silver stain, which is suggestive of aspergillosis. Now let us see about Zhang stain. A vesicle suspected of containing virus is unroofed, its base is scraped and the material is placed on a glass slide. The material is treated with a Wright stain or methylene blue. The presence of multinucleated giant cells indicates herpes virus infection. This picture shows multinucleated giant cells suggestive of herpes infection. Now let us see about other diagnostic methods. Throat culture is 90% sensitive for streptococcal pharyngitis. A good lower respiratory specimen should have 10 epithelial cells and 25 polymorphonuclear neutrophils per low power field. For urine culture, a clean catch midstream urine specimen is needed in patients without a catheter. If there is a catheter, we have to disinfect the tubing and collect directly with a sterile needle and syringe. We should not collect the specimen from the bag. For blood cultures, we have to avoid femoral veins and areas of indwelling catheters because they have a higher rate of contamination. We have to draw two sets to avoid contamination. For CSF specimens, we have to collect serum simultaneously for glucose estimation. For viral cultures, we have to use special transport media if the specimen is from throat or skin. We have to use Buffy coat for herpes simplex virus and cytomegalovirus. For body fluid cultures, we have to collect specimen in a sterile fashion. Now let us see about direct immunofluorescence. In this case, antigens or antibodies are directly labeled and detected by fluorescent microscopy. Now let us see about polymerase chain reaction or PCR. It uses the enzyme DNA polymerase to increase the number of copies, that is, amplify DNA or RNA in a sample. It is very sensitive because only a few copies of genetic material and not the whole organism is need to be present. It is useful for organisms that are difficult to culture like HIV. Now let us see about serologic testing. It is to diagnose the infection when the pathogen cannot be cultured. We measure acute and convalescent sera to detect a 4-fold increase in titer, which indicates recent infection. Diagnosis can only be made retrospectively. Now let us see about bacteriology. First let us see about taxonomy of bacteria. Gram-positive cocci includes Streptococcus and Staphylococcus. Among these, Staphylococcus is catalase positive. Among Staphylococci, Staphylococcus aureus is coagulase positive. Now let us see about classification of Streptococci. Based on hemolysis, they are classified into alpha, beta and gamma. Alpha hemolysis is green or partial hemolysis. A mnemonic to remember is almost hemolytic. It includes Streptococcus pneumoniae and virulence group, that is Streptococcus mutans. Beta hemolysis is clear hemolysis. A mnemonic to remember is better hemolysis. It includes group A Streptococci like Streptococcus pyogenes and group B Streptococci like Streptococcus agalactiae. Gamma hemolysis is no hemolysis. It includes group D Streptococci like Enterococcus and Peptostreptococcus. This picture shows beta hemolysis. This is alpha hemolysis or partial hemolysis, and this is gamma hemolysis or no hemolysis. Streptococcus pneumoniae is bile soluble and optogen sensitive. Capsulated Streptococcus pneumoniae are quelling positive. That is, the capsule swells when antisera is added. This picture shows quelling reaction. As you can see, it demonstrates capsule of Streptococcus pneumoniae. Lancefield grouping of Streptococci is based on C carbohydrate in the bacterial cell wall. Group A Streptococci is bacitracin sensitive. Now let us see about gram-positive bacilli. It includes Clostridium, Listeria, Bacillus and Corynebacterium. Among these, the spore-forming bacteria are Clostridium and Bacillus. The spores are killed by autoclave. They are resistant to heat and most other chemicals. Now let us see about gram-negative cocci. It includes Neisseria meningitidis and Neisseria gonorrhea and Moraxella catarrhalis. Among these, Neisseria meningitidis ferments maltose. Now let us see about gram-negative coccobacilli. It includes Haemophilus influenzae, Pasteurella, Brucella, Bordetella pertussis, Francisella and Legionella. Now let us see about gram-negative rods. They can be divided into lactose fermenters and lactose non-fermenters. The lactose fermenting gram-negative rods include Enterobacter, Escherichia coli and Klebsiella. All these are indicated in urinary tract infections. Among the lactose non-fermenters, Pseudomonas is oxidase positive. Now let us see about obligate intracellular organisms. These include Chlamydia, which steals ATP from the host, and Rickettsia, which lacks coenzyme A and NAD, so it cannot produce its own ATP. Now let us see about obligate aerobes. It includes Nocardia, Pseudomonas, Mycobacterium tuberculosis and Bacillus. Now let us see about obligate anaerobes. It includes Clostridium, Bacteroids and Actinomyces. They do not have catalase or superoxide dismutase, so they are susceptible to oxidative damage. Now let us see about culture requirements of various bacteria. Corynebacterium diphtheriae requires tellurite agar or Loeffler media. Bordetella pertussis requires boarded Gengo potato blood agar. Neisseria gonorrhea requires Thayer-Martin medium, which contains VCN, that is vancomycin, colistin and nystatin. Legionella pneumophila requires charcoal yeast agar with iron and L-cysteine. Mycoplasma pneumoniae requires Eaton agar. Mycobacterium tuberculosis requires Lowenstein-Jensen agar. Vibrio species require thiosulfate citrate bile salts sucrose, that is TCBS agar. Enterococcus requires 40% bile and 6.5% NaCl. Haemophilus influenzae require chocolate agar, which contains factor V or NAD and factor X or hematin. Lactose fermenters like Klebsiella and Escherichia require McConkie agar, in which they grow as pink colonies. Fungi require Sabarad agar. Now let us see about basics of bacteriology. Peptidoglycan is unique to bacterial cell wall. It provides rigid support and resistance against osmotic pressure. Teichoic acid is a cell membrane structure unique to gram-positive organisms. Endotoxin is each stable lipopolysaccharide found in the cell wall of gram-negative bacteria. Listeria monocytogenes is the only gram-positive organism with a lipopolysaccharide lipid A. Now let us see about the systemic effects of endotoxin, particularly lipid A. It increases interleukin 1 leading to fever. It increases tumor necrosis factor leading to hemorrhagic tissue death. It increases nitric oxide causing hypotension and shock. It causes activation of alternate complement pathway leading to elevated C3A and C5A levels. C3A causes edema and C5A causes polymorphonuclear neutrophil chemotaxis. It causes activation of factor 12, which activates coagulation cascade leading to disseminated intravascular coagulation. The fatal dose of exotoxins is 1 microgram, whereas hundreds of micrograms are required for endotoxin fatality. Now let us see about DNA transfer. The various methods include transformation. In this case, DNA is taken up directly from the environment by competent cells, as you can see in this picture. It can occur in eukaryotic cells too. The medically important natural transformers can be remembered by the mnemonic. Here have some new genes, that is Helicobacter pylori, Haemophilus influenzae, Streptococcus pneumoniae and Neisseria gonorrhea. And let us see about conjugation. In this case, plasmid or chromosomal DNA is transferred from one bacterium to another via cell-to-cell contact, as you can see in this picture. In transduction, DNA is transferred by a virus from one cell to another, as you can see in this picture. It can be generalized or specialized. Transposons are DNA segments able to excise and reincorporate into different locations. Now let us see about exotoxins. Staphylococcus aureus. The exotoxin is a superantigen that induces interleukin 1 and interleukin 2 synthesis in toxic shock syndrome. Exotoxin or Staphylococcus aureus can also lead to food poisoning. The exotoxin of Streptococcus pyogenes is erythrogenic superantigen which causes rash in scarlet fever. The exotoxin of Clostridium botulinum prevents release of acetylcholine leading to CNS paralysis. The spores of Clostridium botulinum are found in canned food and honey and construction sites. The exotoxin of Clostridium perfringens is an alpha toxin which is a lecithinase which leads to gas gangrene. The exotoxin of Clostridium tetani prevents the release of neurotransmitter glycine from Renshaw cells in spinal cord leading to paralysis. The exotoxin of Botulella pertussis elevates adenylate cyclase by ADP ribosylation leading to whooping cough. The exotoxin of Corynebacterium diphtheriae is encoded by beta prophage. The alpha subunit inactivates elongation factor 2, halting protein synthesis. The beta subunit permits entry into cardiac and neural tissue. Now let us see about exotoxins of E. coli. The heat stable toxin increases guanylate cyclase. The heat labile toxin increases adenylate cyclase by ADP ribosylation of G protein leading to watery diarrhea. The exotoxin of Shigella dysenteriae inactivates the 60S ribosome and kills intestinal cells. The exotoxin of Vibrio cholerae causes permanent ADP ribosylation of G protein which leads to elevated adenylate cyclase, which leads to increase in chloride ions and water in gut, which causes voluminous stools. Pseudomonas produces exotoxin A which inhibits protein synthesis by blocking elongation factor 2. Now let us see about IgA protease. It is the virulence factor which allows organisms to colonize mucosal surface. It is present in bacteria like Streptococcus pneumoniae and Haemophilus influenzae. Now let us see about antigenic classification. K antigen is capsular antigen. It is related to virulence of the bacterium. A mnemonic to remember is K is capsular antigen. O antigen is cell wall antigen. It is present in outer portion of the polysaccharide of the endotoxin. Our mnemonic to remember is O is outer antigen. H antigen is flagellar antigen which is present in motile species. Now let us see about virulence factors. The virulence factor of Staphylococcus aureus is protein A, which prevents complement fixation and phagocytosis. Other important virulence factors includes penicillinase and hyaluronidase. The virulence factors of group A Streptococcus are M protein, streptokinase and hyaluronidase. The virulence factors of Streptococcus viridans is extracellular dextrin which helps bind to heart valves. For Yersinia pestis, it is F1 capsular antigen which is anti-phagocytic and protease which degrades clots. For Haemophilus influenzae, the capsule has 6 types of virulence factors, that is A to F and IgA protease. For Borrelia, antigenic variation acts as virulence factor. For Mycobacterium tuberculosis, the virulence factors are mycocytes, which includes cod factor, VAX-D and sulfatides. Now let us see about classification of gram-positive cocci. They can be divided into catalase positive and catalase negative. Catalase positive gram-positive cocci can be divided into coagulase positive like Staphylococcus aureus and coagulase negative, which includes novobiocin sensitive bacteria like Staphylococcus epidermidis and novobiocin resistant bacteria like Staphylococcus saprophyticus. The catalase negative bacteria can be divided into beta hemolytic, alpha beta or gamma hemolytic and alpha hemolytic. The beta hemolytic bacteria can be divided into bacitracin sensitive bacteria like Streptococcus pyogenes and bacitracin resistant bacteria like Streptococcus agalactiae. The alpha, beta or gamma hemolytic bacteria can grow in 40% bile, that is, it is group D Streptococcus. They can be divided into bacteria which grow in 6.5% NaCl like Enterococcus faecalis and bacteria which are susceptible to 6.5% NaCl like Streptococcus bovis. The alpha hemolytic bacteria are bile negative. They can be divided into susceptible bacteria like Streptococcus pneumoniae and optocin resistant bacteria like Streptococcus mutans and Streptococcus epidermidis. Now let us see about classification of gram-positive bacilli. They can be divided into spore-forming bacteria and non-spore-forming bacteria. The spore-forming bacteria can be divided into aerobic bacteria and obligate anaerobic bacteria. The aerobic bacteria can be divided into motile bacteria like Bacillus cereus and non-motile bacteria like Bacillus anthracis. The obligate anaerobic bacteria can be divided into motile bacteria which includes Clostridium tetani, Clostridium botulinum and Clostridium difficile. Non-motile bacteria is Clostridium perfringens. The non-spore forming bacteria can be divided into motile bacteria like Listeria monocytogenes and non-motile bacteria like Corynebacterium diphtheriae. Now let us see about gram-positive bacteria which are beaded filaments. It includes Actinomyces israeli, which is not acid fast and an obligate anaerobe, and Nocardia asteroids and Nocardia brasiliensis, which are weakly acid fast and obligate aerobes. Now let us discuss about Staphylococcus aureus. It produces yellow gold pigment as you can see in this picture. It causes scalded skin syndrome and toxic shock syndrome. It is treated with penicillin. We should give vancomycin if it is methicillin resistant Staphylococcus aureus. Now let us see a clinical case. 4-year-old with a superficial skin infection consisting of erythematous pustules with honey colored scabs. This is a case of impetigo caused due to Staphylococcus aureus. This picture shows a case of impetigo. Now let us see another case. Patient presents with sudden onset of severe watery diarrhea, vomiting and abdominal discomfort 4 hours after eating potato salad at a picnic. The symptoms resolve spontaneously within 24 hours. This is a classical case of diarrhea caused due to Staphylococcus aureus. Now let us see about Streptococcus pyogenes. It can cause scarlet fever, impetigo and pharyngitis. Complications include acute post-infectious glomerulonephritis and rheumatic fever. It is treated with penicillin G. Now let us see a clinical case. 6-year-old with recent history of sore throat, presents with multiple joint pain and swelling, fever and shortness of breath. Physical examination shows erythema marginatum, subcutaneous nodules and apical systolic murmur. Workup shows elevated ESR and C-reactive protein. This is a classical case of acute rheumatic fever caused by Streptococcus pyogenes. This picture shows erythema marginatum seen in a case of acute rheumatic fever. Now let us see about Streptococcus agalactiae. It can cause sepsis or meningitis in a newborn. It is a group B Streptococcus. A mnemonic to remember is group B infects babies. It is treated with ampicillin. Now let us see about Streptococcus mutans. It causes dental caries. It is treated with amoxicillin or amoxicillin clavulinate. It can be prevented with topical fluoride or chlorhexidine. Now let us see about Streptococcus viridans with the help of a clinical case. 50-year-old man presents with a fever of unknown origin. 1 month ago, he had a dental procedure. He has a history of rheumatic heart disease. Physical examination shows significant heart murmur, splinter hemorrhages, JNV lesions, rot spots and oscular nodes. This is a classic case of subacute bacterial endocarditis caused by Streptococcus viridans. This picture shows alpha hemolytic Streptococcus viridans. This is beta hemolytic Streptococcus pyogenes. This picture shows splinter hemorrhages seen in a case of subacute bacterial endocarditis caused by Streptococcus viridans. Now let us see about Bacillus anthracis. It causes anthrax which presents as malignant vesicular papules covered with black eschar. It can lead to bacteremia and death. This picture shows a lesion in anthrax. Wool-Sortus disease is the pulmonary form of anthrax. Anthrax is treated with penicillin G or ciprofloxacin. This picture shows fuchsin methylene blue spore stain of Bacillus anthracis. Now let us see about Clostridium perfringens. It can lead to gas gangrene in traumatic open wounds. This picture shows gas gangrene caused by Clostridium perfringens. Now let us see about Clostridium difficile. It can cause pseudomembranous enterocolitis. It is treated with metronidazole or oral vancomycin. This picture shows crystal violet stain of Clostridium botulinum. Now let us see a clinical case. Patient with history of antibiotic use presents with fever, bloody diarrhea and abdominal pain. On examination, you find tender abdomen, guaiac stool positive, there is blood in stools. CBC shows leukocytosis. Colonoscopy shows tan nodules seen attached to the erythematous bowel wall with superficial erosions. This is a classic case of pseudomembranous colitis or Clostridium difficile colitis. This picture shows bowel wall in a case of pseudomembranous colitis. Now let us see about fungi-like bacteria. It includes Actinomyces israeli and Nocardia asteroids. Actinomyces israeli causes oral or facial abscesses with sulfur granules in sinus tract. This picture shows a case of facial abscess caused by Actinomyces israeli. On examination, you will find filamentous branching rods as you can see in this picture. It is treated with IV penicillin G. Nocardia contains mycolic acid in membranes. Corynebacterium diphtheriae are gram-positive rods with metachromatic granules as you can see in this picture. Now let us see about Gardnerella vaginalis. These are gram-variable anaerobes. They cause bacterial vaginosis with discharge and fishy odor. On examination, we can find clue cells on wet mount. It is treated with metronidazole. Now let us see a clinical case. 25-year-old woman presents with malodorous vaginal discharge. On workup, there is visualization of the discharge under the microscope demonstrating multiple vaginal epithelial cells covered in bacteria. These are known as clue cells. This is a classic case of bacterial vaginosis caused by Gardnerella vaginalis. This picture shows clue cells which are vaginal epithelial cells covered in bacteria. Now let us see about classification of gram-negative diplococci. They can be divided into maltose and glucose oxidaser like Neisseria meningitidis. A mnemonic to remember is meningitidis oxidases maltose. Only glucose oxidaser, that is Neisseria gonorrhea. And you need to remember is gonorrhea oxidizes only glucose. And oxidase positive gram-negative diplococci, which is Moraxella catarrhalis. Now let us see about classification of gram-negative bacilli. They can be divided into lactose fermenter, lactose non-fermenter, bacteria which show curved small growth on Campi agar and strict anaerobes. Lactose fermenters are fast fermenters. Based on biochemical tests, they can be divided into Klebsiella pneumonia. E. coli is indole positive. Lactose fermenters can be divided into oxidase negative bacteria, oxidase positive bacteria, bacteria which is mobile at 25 degrees Celsius and not mobile at 37 degrees Celsius, and bacteria which shows bipolar staining. Oxidase negative bacteria can be divided into bacteria which produce hydrogen sulfide and which are motile. Examples include Salmonella typhi and Salmonella enteritidis. Bacteria which does not produce hydrogen sulfide and which is non-motile. Example is Shigella dysenteriae. And bacteria which is urease positive like Proteus mirabilis. Oxidase positive lactose non-fermenter can be divided into bacteria which ferments glucose like Vibrio cholerae and Pseudomonas aeruginosa. The bacteria which is motile at 25 degrees Celsius and not at 37 degrees Celsius is Yersinia enterocolitica, and the bacteria which shows bipolar staining is Yersinia pestis. Curved small growth on Campi agar bacteria can be divided into urease positive like Helicobacter pylori and urease negative bacteria like Campylobacter jejuni. Bacteroides fragilis is a strict anaerobic gram-negative bacilli. Now let us see about gram-negative Coccobacilli or pleomorphic bacteria. They can be divided into bacteria which requires factors X and V, that is Haemophilus influenzae. Bacteria which grows on charcoal yeast agar with iron and cysteine, that is Legionella pneumophila. Bordetella pertussis grows on bordered gingo medium. Brucella is aerobic. Francisella tularensis is requires cysteine for growth. Pastorella multocida is oxidase positive and catalase positive. Bartonella henselae shows positive silver impregnation stain. Now let us see about Neisseria meningitidis. It can cause meningitis and meningococcemia. An important complication of Neisseria meningitidis is Waterhouse-Friderichsen syndrome, which is massive bilateral hemorrhage into the adrenal glands caused by fulminant meningococcemia. It is treated with ceftriaxone. This picture shows gram stain of Neisseria meningitidis. Now let us see about Neisseria gonorrhea. It can cause gonorrhea, gonococcemia, septic arthritis, and gonococcal ophthalmia neonatorum. An important complication of Neisseria gonorrhea is Fitzhugh-Curtis syndrome. In this case, pelvic inflammatory disease causes liver capsule inflammation leading to adhesions. Now let us see a clinical case. 18-year-old sexually active woman presents with history of treatment for purulent vaginitis, presents with fever, tenderness, warmth and swelling of her right knee. This is a classical case of gonococcal arthritis. This picture shows gram stain of Neisseria gonorrhea. Now let us see about Klebsiella pneumoniae. It causes currant jelly sputum. It is treated with first or second generation cephalosporins. This picture shows currant jelly sputum seen in the case of Klebsiella pneumoniae. Now let us see about Klebsiella granulomatous. Let us see a clinical case. 26-year-old sexually active man presents with painless beefy red ulcers of the genitalia and inguinal swelling. Workup shows Donovan bodies on Giemsa stain smear. This is a classic case of granuloma inguinal. This is the beefy red ulcer seen in the case of Klebsiella granulomatous, and this picture shows Donovan bodies in Giemsa stain. Salmonella invades gastrointestinal mucosa leading to diarrhea. Salmonella are motile and can disseminate hematogeneously. Now let us see about Pseudomonas aeruginosa. It produces pyocyanin, that is a blue-green pigment. This picture shows culture of Pseudomonas aeruginosa demonstrating blue-green pigment. It causes burn and wound infections with fruity odor. It can cause pneumonia, sepsis, otitis externa, urinary tract infections, hot tub folliculitis and osteomyelitis. It is treated with aminoglycoside plus an anti-pseudomonal antibiotic like piperacillin and tazobactam. Now let us see a clinical case. 17-year-old swimmer presents with pain and discharge from the left ear. On examination, movement of tragus is extremely painful and gram stain shows gram-negative rods. This is a classic case of otitis externa caused by Pseudomonas aeruginosa. Now let us see about Pseudomonas cepaceae. It can cause pneumonia in cystic fibrosis patients and burns patients. It is treated with Bactrim or ciprofloxacin. Now let us see about Yersinia pestis. It causes bubonic plague. The mode of transmission is by flea bite. The reservoirs are rodents. This picture shows a rat flea which transmits Yersinia pestis. It is treated with gentamicin. Urease positive bacteria include Helicobacter pylori, Proteus, and Ureaplasma urealyticum. Now let us see about Helicobacter pylori. It causes gastritis and around 90% of duodenal ulcers. It is treated with triple therapy, which includes amoxicillin, clarithromycin, and a proton pump inhibitor. Now let us see about Serratia marcescens. It produces reddish pigments, as you can see in this picture. It causes hospital acquired infections, especially catheter associated bacteremia. Now let us see about Haemophilus influenzae. It can cause meningitis and pneumonia in neonates. It can also cause acute epiglottitis, meningitis, otitis media, and pneumonia in adults. It is treated with second generation cephalosporins. We have to treat meningitis caused by Haemophilus influenzae with ceftriaxone plus rifampin for contacts. Now let us see about Haemophilus ducreyi. These are pleomorphic gram-negative rods in school of fish pattern. This picture shows gram stain of Haemophilus ducreyi showing school of fish pattern. It causes a sexually transmitted disease, that is chancroid. It can be treated with a macrolide like azithromycin and a third generation cephalosporin like ceftriaxone. Now let us see about Legionella pneumophila. It shows aerosol transmission from environmental water source, or it can be transmitted due to air conditioners in hospitals. It causes Pontiac fever. It can be treated with a macrolide like erythromycin or azithromycin. Now let us see about Brucella species. It causes untitled fever and Bang disease. The mode of transmission is contact with animals or dairy products, and the reservoirs are cows. It is treated with doxycycline plus gentamicin or rifampin. We have to pasteurize milk to prevent Brucella infection. And let us see about Francisella tularensis. It causes tularemia. This picture shows a case of tularemia. The mode of transmission is by tick or deer fly bite, and the reservoirs are rabbits and deer. Now let us see about Pastorella multocida. It causes pastorellosis. The mode of transmission is by animal bite or scratch, and the reservoirs are cats and dogs. Now let us see about Bartonella quintana. It causes trench fever, which lasts 5 days and recurs in 5-day cycles. It is treated with gentamicin or doxycycline. Now let us see about Bartonella henselae. Let us see a clinical case. 15-year-old new pet owner presents with painful axillary lumps and fever. On examination, we find cervical lymphadenopathy. This is a classic case of cat scratch disease, which is caused due to Bartonella henselae. This picture shows lesions in a case of cat scratch disease. Now let us see about classification of acid-fast bacteria. They are thin rods, non-motile, and obligate aerobes. They can be divided into Mycobacterium tuberculosis and Mycobacterium leprae. Mycobacterium leprae grows at low temperatures and it is phenolase positive. Now let us see about classification of spirochetes. They can be divided into microaerophilic spirochetes, which are sensitive to high temperatures like Treponema pallidum. Giemsa and Silverstein positive microaerophilic spirochetes like Borrelia burgdorferi and Borrelia recurrentis. Aerobic spirochete, which shows eye-stung appearance like Leptospira intragans. Bacteria which are neither gram positive or gram negative include Mycoplasma pneumoniae, Chlamydia psittaci, Chlamydia trachomatis, Chlamydia pneumoniae, Rickettsia rickettsii, Rickettsia prowazekii, and Coxiella bruneti. Now let us see about Mycobacterium. It contains mycolic acid in membranes. First let us see about Mycobacterium tuberculosis. The mode of transmission is respiratory droplets. Primary TB is characterized by Ghon complex, which includes hilar nodes plus Ghon focus. This picture shows chest X-ray of Ghon complex showing hilar nodes and Ghon focus. Primary TB is usually in lower lobe. Now let us see about secondary TB. It causes fibrocaseous cavitary lung lesion. It classically affects apical lungs. This is because it has high affinity for high oxygen environment. This picture shows fibrocaseous cavitary lung lesion in a case of secondary TB. Symptoms of secondary TB include cough, hemoptysis, fever, night sweats, and weight loss. In biliary TB, there is lymphatic and hematogenous spread of TB causing numerous small foci of infection in extrapulmonary sites. In TB, there will be type 4 or delayed type hypersensitivity, which forms the basis for tuberculin test or purified protein derivative test. Histopathology shows caseating granulomas showing Langerhans-Jain cells. This picture shows histopathology of tuberculosis showing caseating granuloma and Langerhans-Jain cell. Now let us see about extrapulmonary tuberculosis. It can affect central nervous system causing tuberculous meningitis, vertebral bodies causing Pott's disease, psoas major causing abscesses, GI tract which can affect liver and cecum. It can affect cervical lymph nodes leading to scrophulodoma. Latent TB is characterized by a positive purified protein derivative test and no active signs of TB. It should be treated with isoniazid plus pyridoxine, that is vitamin B6 for 9 months. Now let us see about active TB infection. It is diagnosed based on clinical and radiologic signs of secondary TB and acid-fast bacilli in sputum. Now let us see about the treatment of active TB infection. Respiratory isolation and multidrug therapy, which includes rifampin, isoniazid, pyrazinamide, and ethambutol. And let us see about the adverse drug reactions of antitubercular drugs. Most of them will cause hepatotoxicity. Isoniazid can cause vitamin B6 deficiency and ethambutol can cause optic neuritis. And let us see about Mycobacterium leprae. It infects skin and superficial nerves and causes Hansen disease or leprosy. Treatment options include dapsone, clofazimine, and rifampin. Now let us see about Mycobacterium avium intracellulare. It can cause disseminated disease in AIDS patients. Now let us see about Mycobacterium scrofulaceum. It causes cervical lymphadenitis in kids, as you can see in this picture. Now let us see about Treponema pallidum. It causes syphilis. Complications include tabes dorsalis, iotitis, and gummas, which are features of tertiary syphilis. This picture shows chancre in case of primary syphilis. VDRL test is a screening test for syphilis. False positive results can occur due to viral infections like mononucleosis and hepatitis. Drugs like narcotics, rheumatoid arthritis or rheumatic fever, leprosy, and lupus. Fluorescent treponemal antibody absorption test or FTA-ABS is sensitive for treponems. It is used as confirmatory test for syphilis if RPR or VDRL is positive. Syphilis is treated with penicillin G. Now let us see a clinical case. 28-year-old with history of treatment for secondary syphilis 5 years ago with intramuscular penicillin, presents with fever, chills, myalgias, and headache. This is a case of Jarisch eczema reaction, which is reaction to endotoxin-like products released by death of microbes within the body due to antibiotic treatment. Now let us see about Treponema pallidum. pertinue. It causes yaws, which is infection of skin, bones and joints. It is treated with penicillin G. And let us see about Borrelia burgdorferi. It causes Lyme disease. It is transmitted by Ixodes tick bite and it lives on deer and mice. This picture shows Ixodes tick. Borrelia burgdorferi infections are treated with doxycycline. Now let us see a clinical case. 8-year-old from Connecticut, USA, presents with fever, rash, headache and joint pain after playing in the woods. Physical examination shows distinctive macule with surrounding 6 cm target shaped lesion. This is a classic case of Lyme disease. Now let us see about Leptospira intragans. It causes leptospirosis. A severe form of the disease is wheal disease. In this case, there will be liver and kidney failure. Leptospirosis is treated with penicillin G. Now let us see about Mycoplasma pneumoniae. It is the only bacterial membrane containing cholesterol. It causes atypical walking pneumonia in young adults. Lab investigations will show high titer of cold agglutinins, that is IgM. It is treated with erythromycin or doxycycline. And let us see about chlamydia. The peptidoglycan wall lacks muramic acid. It has two forms, that is elementary form and reticulate bodies. Now let us see about chlamydia psittaci. It causes atypical pneumonia with avian reservoir. Clinical features include harder spots, which are pink maculopapular lesions that occur on the trunk. And let us see a clinical case. 44-year-old parrot owner presents with fever, chills, headache and cough. Physical examination shows harder spots on abdomen and splenomegaly. Chest X-ray shows bilateral interstitial infiltrates. This is a classical case of psittacosis caused by chlamydia psittaci. Now let us see about chlamydia trachomatis types D to K. It can cause urethritis or pelvic inflammatory disease, neonatal conjunctivitis and pneumonia. An important complication is Fitz-Hugh-Curtis syndrome. It is treated with erythromycin eye drops for neonatal conjunctivitis, azithromycin for urethritis and pneumonia. Now let us see a clinical case. 25-year-old sexually active man presents with dysuria, irritation and cloudy discharge. On workup, a gram stain of the discharge reveals neutrophils but no organisms are visualized. This is a classic case of non-gonococcal urethritis caused by chlamydia trachomatis types D to K. Now let us see about Rickettsia rickettsii. It causes Rocky Mountain spotted fever. It is transmitted by tick bite. The reservoirs are dogs, rabbits and rodents. It is endemic to eastern United States. Now let us see about the differential diagnosis of Rocky Mountain spotted fever. That is, these conditions can present with rash on palms and soles. The various differential diagnoses include secondary syphilis, hand, foot and mouth disease, which is caused by Coxsackie A virus and Kawasaki syndrome. This picture shows rashes in a case of Rocky Mountain spotted fever. Now let us see about wheal Felix reaction. It is done to diagnose Rickettsia rickettsii infection. It detects anti-Rickettsian antibodies. It can cross-react with protease. Rocky Mountain spotted fever is treated with tetracycline or doxycycline. Now let us see a clinical case. 25-year-old West Virginian man, that is from USA, presents with fever, headache, myalgia and a pedicle rash that began peripherally but now involves his whole body, even his palms and soles. On workup, there is positive OX19 and OX2 wheal Felix reaction. This is a classic case of Rocky Mountain spotted fever. Now let us see about Rickettsia prowazekii. It causes epidemic typhus. It is transmitted by human body louse. Reservoirs include humans and flying squirrels. Now let us see about Coxella burnetii. It causes acute Q fever. It is treated with doxycycline. Now let us see about normal dominant flora in various parts. Nose as Staphylococcus aureus. Oropharynx as group B streptococci, that is Streptococcus viridans. Dental plaques contain Streptococcus mutans. Colon has Bacteroides fragilis more than E. coli. Vagina has Lactobacillus and it is colonized by E. coli and group B streptococcus. Skin has Staphylococcus epidermidis. And let us see about nosocomial pathogens. Urinary catheters can contain E. coli and Proteus mirabilis. Respiratory therapy equipment and ventilators can contain Pseudomonas aeruginosa. Wound infections can contain Staphylococcus aureus. Water aerosols in hospitals include Legionella species. Now let us see about virology. First let us see about taxonomy and basics in virology. DNA viruses can be remembered by the mnemonic HAPPY with a double H and triple P. Hep adenoviridae, herpes viridae, adenoviridae, pox viridae, parvoviridae and papaver. Circular DNA viruses include papaver and hepadinaviride. Only single stranded DNA viral genome is parvovirus. Only DNA virus that replicates in the cytoplasm is poxviridae. It carries its own DNA dependent RNA polymerase. Naked DNA viruses can be remembered by the mnemonic PAP, parvovirus, adenovirus and papavirus. And let us see about RNA viruses. Only double-stranded RNA viral genome is reoviruses like rotavirus. Smallest RNA viruses are picornaviruses. Naked RNA viruses can be remembered by the mnemonic CRAP, calicivirus, reovirus, astrovirus and picornavirus. RNA viruses that do not replicate solely in the cytoplasm include influenza viruses and retroviruses. Segmented RNA viruses can be remembered by the mnemonic BOR, Bunniaviridae, Orthomyxoviridae, which includes influenza viruses, Arenaviridae and Reoviridae. Retroviruses are the only diploid viruses. Enveloped viruses acquire their membranes from plasma membrane except herpes viruses which acquire their membrane from nuclear membrane. Nucleic acids with same structure as host nucleic acids, like in the case of positive stranded single stranded RNA and most naked double stranded DNA viruses, do not require special enzymes to be infectious. Now let us see about viral genetic strategies. Phenotypic mixing. In this case, the virus contains its own genetic material but is coated with surface proteins from another virus which determines its infectivity. Reassortment occurs when viruses exchange segments of their genomes. Complementation occurs when a non-mutated virus assists a mutated one by making a functional gene product that serves both itself and the mutated virus. Recombination is exchanging oligonucleotides by crossing over within base sequences. And let us see about classification of RNA viruses. They can be divided into RNA viruses with icosahedral nucleocapsid and RNA viruses with helical nucleocapsid. Icosahedral RNA viruses can be divided into non-enveloped and enveloped. Enveloped viruses can be divided into single-stranded positive sense non-segmented viruses and double-stranded segmented viruses. Single-stranded positive sense non-segmented RNA viruses include Picornaviridae, which includes enteroviruses like poliovirus, Coxsackie and hepatitis A virus and rhinovirus. Caliciviride includes caliciviruses like Norwalk virus and hepatitis C virus. Double-stranded segmented non-enveloped viruses include reoviruses like rotavirus and cultivirus. Enveloped icosahedral RNA viruses can be divided into single-stranded positive sense non-segmented viruses which includes Togaviridae. Examples include alphavirus and rubyvirus, and flaviviridae. Examples include flavivirus and hepatitis C virus. Single segment positive sense diploid viruses include retroviruses like lentivirus and human T-cell lymphotropic virus 1 and 2. Single stranded negative sense circular RNA viruses include delta virus. Helical nucleocapsid RNA viruses are enveloped. They can be divided into single-stranded positive sense non-segmented viruses, which includes coronaviridae, which has coronavirus. Single-stranded negative sense segmented viruses include Bunyaviridae, which includes Bunya virus and hantavirus. Arenaviridae, which includes arenavirus, and Orthomyxoviridae, which includes influenza virus A, B, and C. Single-stranded negative sense non-segmented viruses include Paramyxoviridae, which includes Paramyxovirus, Pneumovirus, Rubella virus, and Morbillivirus. Rhabdoviridae, which includes Lysavirus, and Filoviridae, which includes Filovirus. Now let us see about poliovirus. It causes necrosis of large motor neurons in anteneuron spinal cord, leading to flaccid paralysis. Now let us see about polio vaccines. Sabin polio vaccine is live attenuated vaccine. It may very rarely revert to virulence. It is dangerous to give live attenuated Sabin polio vaccine in immunocompromised hosts like transplant recipients, AIDS patients, and pregnant women. Salk polio vaccine is killed vaccine. A mnemonic to remember is Salk is killed. Now let us see about Coxsackie virus. It can cause herpangina and hand, foot, and mouth disease. This picture shows lesions in a case of hand, foot, and mouth disease. Now let us see about Coxsackie virus. It can cause pericarditis, myocarditis, and pleurodynia. Now let us see a clinical case. 37-year-old man with a recent history of upper respiratory tract infection, presents with fever and severe chest pain. Physical examination shows friction rub and Kussmaul sign. Workup shows elevated ESR, normal cardiac enzymes, and diffuse ST elevations on ECG. This is a classic case of acute pericarditis, probably due to Coxsackie virus. Now let us see about human T-cell leukemia or lymphoma virus or HTLV. It can cause tropical spastic paralysis. HTLV1 is associated with adult T-cell lymphoma. HTLV2 is associated with hairy cell leukemia. Now let us see about hepatitis A. It can cause acute viral hepatitis. Now let us see a clinical case. 14-year-old boy with a positive history for travel to hepatitis A endemic area, presents with jaundice and dark yellow urine. Physical examination shows icterus and firm hepatomegaly. Workup shows elevated bilirubin, elevated liver function test, and ALT more than AST. This is a classic case of acute viral hepatitis due to hepatitis A. Hepatitis C virus causes hepatitis from IV drug abuse or blood transfusion. It can lead to hepatocellular carcinoma. Hepatitis E virus causes hepatitis with high mortality rate in pregnant women. Now let us see about rotavirus. It is the most common cause of diarrhea in kids less than 3 years of age. Rhinoviruses cause common cold. Almost 85% of cases of common cold are due to rhinoviruses. There are more than 100 serotypes of rhinoviruses. Norwalk virus can cause explosive gastroenteritis. It causes epidemics on cruise ships and schools. Filoviridae includes viruses which cause Marburg and Ebola hemorrhagic fever. Bunyaviridae includes hantavirus and virus which causes California encephalitis. Arenaviridae includes viruses which cause Lassa fever and lymphocytic choriomeningitis. Now let us see about classification of DNA viruses. They can be divided into icosahedral nucleocapsid DNA viruses and complex nucleocapsid DNA viruses. Icosahedral viruses can be divided into non-enveloped and enveloped. Non-enveloped viruses can be divided into viruses with single-stranded linear DNA like parvovirus, example is erythrovirus. Double-stranded circular DNA like papoviridae, which includes papillomavirus and polyomavirus. Double-stranded linear DNA virus like adenovirus, example is mastadenovirus. Enveloped viruses can be divided into viruses with double-stranded linear DNA like herpes virus, which includes herpes simplex virus 1 and herpes simplex virus 2. Varicella virus cytomegalovirus, and lymphocryptovirus. Double-stranded circular enveloped icosahedral DNA viruses include hepatidinaviridae viruses like orthohepatidinavirus. Complex nucleocapsid DNA viruses are enveloped. They have double-stranded linear DNA, and it includes poxviridae like orthopox virus and molluscpox virus. Now let us see about herpes simplex virus. Herpes simplex virus 1 causes gingivostomatitis, keratitis, and temporal lobe encephalitis. Herpes simplex virus 2 causes genital and neonatal infections. Zank preparation shows multinucleated giant cells in a case of herpes simplex virus. Tissues also show Cowdery type A inclusion bodies, which are intranuclear inclusion bodies. This picture shows lesions caused due to herpes simplex virus 1. These pictures show lesions caused due to herpes simplex virus 2. This picture shows a multinucleated giant cell in Zank preparation, and these are Cowdery type A inclusion bodies. And let us see about varicella zoster virus or VZV. It causes chickenpox and shingles. Zank preparation shows multinucleated giant cells. Histopathology shows Cowdery type A inclusion bodies. Now let us see clinical cases. 10-year-old presents with fevers and a pruritic rash spreading from trunk to arms. Physical examination reveals vesicles of varying stages. This is a classic case of chickenpox caused due to varicella zoster virus. This picture shows a case of chickenpox. Now let us see another case. 73-year-old presents with painful unilateral vesicular rash in the distribution of the ophthalmic branch of trigeminal nerve. Cornea shows diminished sensation and it stains with fluorescent. This is a classic case of herpes zoster ophthalmicus, which is a complication of varicella zoster virus. This picture shows herpes zoster ophthalmicus. This is a case of shingles. Remember, in both varicella zoster virus and herpes simplex virus, there will be multinucleated giant cells in Zank smear and Cowdery type A inclusion bodies. Now let us see about cytomegalovirus or CMV. It causes congenital infections and pneumonia. It can cause nosocomial infection associated with the newborn nursery. Blood smear shows atypical lymphocytes. Histopathology shows Cowdery type A inclusion bodies. Viral culture should be done with Buffy coat. Now let us see a clinical case. A newborn presents with rash and maternal history of intrauterine growth restriction and flu during first trimester. Physical examination shows petechial rash, chorioretinitis, microcephaly, reduced hearing, and hepatosplenomegaly. Workup shows low platelets and periventricular calcifications on HCT. This is a classic case of congenital cytomegalovirus. This picture shows blood smear showing atypical lymphocytes in a case of cytomegalovirus infection. This picture shows rashes in a case of congenital cytomegalovirus infection. And let us see about rabies virus. It is transmitted by dogs and bats. Rabies virus is a bullet-shaped virus with helical nucleocapsid. It travels up nerve axons to central nervous system in retrograde fashion. Clinical features include hydrophobia, seizures, and fatal encephalitis. Histopathology shows Negri bodies in neurons, which are intracytoplasmic inclusion bodies. This picture shows Negri bodies in a case of rabies. Arboviruses are transmitted by arthropods and they can cause diseases like chikungunya and dengue. Yellow fever virus. Histopathology shows Councilman bodies in liver. This picture shows Councilman bodies in a case of yellow fever virus. Clinical features include fever, black vomitus, and jaundice. It is transmitted by Aedes mosquito. Now let us see about respiratory syncytial virus or RSV. It is the most common cause of viral pneumonia in infants less than 6 months of age. It can also cause nosocomial infection associated with newborn nursery. Now let us see about measles virus or rubiola. Clinical features include cough, coryza and conjunctivitis. It can cause Koplik spots. A severe but rare sequelae of measles is giant cell pneumonia and subacute sclerosing panencephalitis. Now let us see a clinical case. 6-year-old unvaccinated child presents with rhinorrhea, cough and conjunctivitis. Physical examination shows oral lesions which are bluish with an erythematous border. These are the classic Koplik spots seen in a case of measles. This picture shows Koplik spots in a case of measles. Now let us see about JC polyomavirus. JC stands for John Cunningham. It causes progressive multifocal leukoencephalopathy or PML. Reactivation of JC polyomavirus in brain of AIDS patient can cause demyelination and death of nervous tissue leading to PML. Now let us see about hepatitis B virus. The viral particle is called Dane particle. It causes acute viral hepatitis. It can lead to hepatocellular carcinoma. Now let us see about hepatitis D virus. It is an incomplete RNA virus and it requires envelope. It is always associated with hepatitis B virus. Now let us see about Epstein-Barr virus. It is abbreviated as EBV and it causes infectious mononucleosis. Clinical features include fever, hepatosplenomegaly, pharyngitis and posterior auricular lymphadenopathy. It is also known as kissing disease. Epstein-Barr virus is associated with Burkitt lymphoma and nasopharyngeal carcinoma. Lab findings include atypical lymphocytes and positive heterophile antibody test. This picture shows a clinical case of infectious mononucleosis. Now let us see a clinical case. 18-year-old student returns to clinic with a rash after being treated with ampicillin for fever and sore throat. Physical examination shows tonsillar exudates and enlarged posterior cervical lymph nodes. Workup shows elevated lymphocytes and a positive heterophile antibody test. This is a classical case of infectious mononucleosis. And let us see about rubella virus. It causes German measles and congenital infections. Clinical features include suboccipital lymphadenopathy. Now let us see a clinical case. 2-month-old child with maternal history of rash and flu in the first trimester presents with a rash and failure to attain milestones. Physical examination shows microcephaly, cataracts, jaundice and continuous missionary-like murmur at left upper sternal border and hepatosplenomegaly. This continuous missionary-like murmur is due to patent ductus arteriosus, which is a feature of congenital rubella. Pox viridae includes smallpox, molluscum contagiosum and vaccinia viruses. Now let us see about molluscum contagiosum virus. It causes small, pearly, umbilicated papillar epidermal growths near genitals. This picture shows molluscum contagiosum. Now let us see about human herpes virus 6, that is HHV6. It causes exanthem subitum or roseola. This picture shows a clinical case of roseola. Now let us see about influenza A virus. It contains hemagglutinin and neuraminidase virulence factors. This picture shows neuraminidase and this is hemagglutinin or sialidase. It can cause Reye syndrome which occurs with aspirin ingestion. Now let us see a clinical case. 9-year-old with recent viral prodromal illness presents to emergency room with vomiting and lethargic after being given aspirin for fever. Workup shows impaired liver function and CT shows cerebral edema. This is a classic case of Reye syndrome which occurs due to influenza infection and aspirin ingestion. Now let us see about antigenic drift. It is an antigenic change in the influenza virus. It occurs due to minor changes from random mutation. It is a slow process and it causes epidemics. Now let us see about antigenic shift. It is another antigenic change in the influenza virus. It is due to reassortment of genome including animal acquisition. It is a rapid process and it leads to pandemics. Now let us see about adenoviruses. They can cause intersusception from hyperplasia of pair patches. They can also cause epidemic keratoconjunctivitis and childhood upper respiratory tract infections. Now let us see about human herpes virus 8. It causes Kaposi sarcoma. This picture shows Kaposi sarcoma in an AIDS patient. Mumps virus can cause aseptic meningitis, orchitis or inflammation of testis, and parotitis or inflammation of parotid gland. And let us see about parainfluenza viruses. They can cause barking cough and laryngeal swelling leading to croup. Now let us see a clinical case. 4-year-old presents with barking cough, fever and rhinorrhea. Physical examination shows respiratory distress and tachypnea. X-ray of soft tissues of neck shows steeple sign. This is a classic case of croup. This picture shows steeple sign in a case of croup caused by parainfluenza virus. Now let us see about human papilloma virus or HPV. It is a cause of common and genital warts. HPV types 16, 18, 31, 33 and 45 are associated with cervical, penile and anal carcinoma. This picture shows genital warts caused due to human papillomavirus infection. Now let us see about parvovirus B19. It causes erythema infectiosum or fifth disease. It also causes transient aplastic anemic crisis. This picture shows a child suffering from erythema infectiosum or fifth disease showing slapped cheek appearance. Now let us see a clinical case. 10-year-old with sickle cell disease and recent history of prodromal illness presents with sudden onset, pallor, fatigue and tachycardia. Complete blood count shows pancytopenia with reticulocytopenia. This is a classic case of aplastic anemic crisis caused due to parvovirus B19 in a sickle cell patient. Now let us see another case. 8-year-old presents with fever, photophobia, stiff neck and headache. Physical examination shows positive Kernig and Rudzinski signs. Lumbar puncture shows normal glucose. White blood cell count less than 300 cells per millimeter cube. This is a classic case of viral meningitis. Now let us see the features of different types of meningitis. In bacterial meningitis, there will be more than 1000 white blood cells. It will be predominantly neutrophils. Glucose will be reduced and protein will be increased. In case of viral meningitis, there will be increased lymphocytes, minor elevation in proteins, normal glucose and normal CSF pressure. In fungal meningitis, there will be increased lymphocytes, minor elevation in protein and elevated CSF pressure. In this case, the glucose is normal and the white blood cells is less than 300 cells per millimeter cube. So this is viral meningitis. Now let us see about HIV or human immunodeficiency virus. It is a human retrovirus of the lentivirus family. The highest incidence and prevalence of HIV is in Africa. Now let us see about the glycoproteins of HIV. The glycoproteins on the surface of HIV viral envelope include GP41 or fusion glycoprotein and GP120 or attachment glycoprotein. Together they form GP160. This is GP120 and this is GP41. These are the glycoproteins on the surface of HIV. GP120 binds to CD4 and a chemokine receptor like CCR5 or CXCR4 cell surface molecules. Now let us see about HIV viral core proteins. It includes P24 or nucleocapsid protein and P17 or matrix protein. P24 peaks within 2 months of infection, then rises again years later. Now let us see about the HIV retroviral enzymes contained in the core. It includes reverse transcriptase, integrase and protease. All are encoded by Pol gene. This is the integrase, this is reverse transcriptase and this is protease. All these are HIV retroviral enzymes contained in the core. Now let us see about reverse transcriptase or RT. It creates double stranded DNA from RNA for integration into host genome. Let us see about routes of transmission of HIV. Sexual contact. The most common route is heterosexual contact. Vertical, that is mother to newborn transmission, and parental. HIV infects CD4 plus T cells, monocytes or macrophages, and dendritic cells. Now let us see about the immune abnormalities caused by HIV. Decreased number of CD4 plus T cells, decreased T cell function, polyclonal activation of B cells, and altered macrophage function. The induction of nuclear factor kappa B, that is NF kappa B, during an immune response leads to activation of transcription of HIV proviral DNA. HIV infected CD4 plus T cells are lost due to HIV cytopathic effect, apoptosis, and HIV specific cytotoxic T cell killing. Now let us see about reservoirs of HIV infected T cells and macrophages. These include lymph nodes, spleen, and tonsils. Now let us see about the stages of HIV infection: acute retroviral infection, chronic phase, and AIDS. Now let us see about the features of direct viral disease due to HIV. There will be constitutional symptoms like weight loss, fever, fatigue, and night sweats. There will be neurologic symptoms like encephalopathy with dementia and aseptic meningitis. All these occur due to direct viral HIV disease. And let us see about screening of HIV. ELISA is done. It looks for antibodies to viral proteins. It has high sensitivity. HIV is confirmed by Western blot assay. It has high false negative when done within 2 months of infection. It has high specificity. HIV-1 RNA is a surrogate measure of viral load in an HIV positive patient. Now let us see about HIV reverse transcriptase PCR. It measures viral load. It is used to monitor the effects of antiretroviral therapy. CD4 plus T cell count is the strongest measure of disease progression in an HIV positive patient. AIDS is defined as CD4 plus count less than 200 cells per millimeter cube or AIDS defining illness regardless of CD4 plus count. Now let us see about AIDS opportunistic infections and the CD4 plus count in which they occur. Fungal infections include candidiasis, which affects GI tract, cryptococcosis, which causes meningitis, histoplasmosis, which is disseminated, coccidioidomycosis, which is also disseminated. Bacterial infections include Mycobacterium tuberculosis, which affects the lung or it can be disseminated. It usually occurs when the CD4 plus count is less than 400 cells per millimeter cube. Mycobacterium avium intracellulare, it affects lung and it usually occurs when the CD4 plus count is less than 50 cells per millimeter cube. Nocardia, which can affect lung or central nervous system or it can be disseminated. Salmonella, which is disseminated, and other encapsulated organisms. Now let us see about viral opportunistic infections. It includes herpes simplex virus, varicella zoster virus, which can cause shingles, cytomegalovirus, which causes retinitis or colitis. It occurs when the CD4 plus count is less than 50 cells per millimeter cube, and JC virus, which causes progressive multifocal leukoencephalopathy. Now let us see about protozoal opportunistic infections. It includes pneumocystis erythroideae pneumonia, which affects the lung or it can be disseminated. It occurs when the CD4 plus count is less than 200 cells per millimeter cube. Toxoplasma, which can affect the lung or central nervous system. It occurs when the CD4 plus count is less than 100 cells per millimeter cube. And Cryptosporidium, which is a GI infection, and it occurs when the CD4 plus count is less than 50 cells per millimeter cube. Now let us see about the neoplasms that can occur in an AIDS patient. It includes Kaposi sarcoma, non-Hodgkin B-cell lymphoma, CNS lymphoma, and squamous cell carcinoma of cervix or anus. All these neoplasms are associated with HIV. To minimize the risk of perinatal HIV transmission, we can give zidovudine to pregnant women. We can do cesarean delivery and we can avoid breastfeeding. Now let us see about prions. They are infectious agents that lack both DNA and RNA. They are made of proteins only. Now let us see about prion diseases. Prions can cause Creutzfeldt-Jakob disease or rapidly progressive dementia, mad cow disease, Kuru, and fatal familial insomnia. Now let us see about the symptoms of prion diseases. It includes rapidly progressing dementia, psychiatric disturbances, and cerebellar symptoms like ataxia and myoclonus. All the prion diseases are usually fatal. Histopathology of prion diseases reveals spongiform encephalopathy. This picture shows neural tissue affected by prion disease. As you can see, it resembles a sponge. This is known as spongiform encephalopathy. Now let us move on to mycology. First, let us see about classification of fungi. Fungi can be divided into cutaneous fungi, which includes dermatophytes like Microsporum, Trichophyton, and Epidermophyton. Cutaneous fungi like Sporothrix schenki, systemic fungi like Coccidioides immitis, Histoplasma capsulatum, and Blastomycosis dermatidis. Opportunistic fungi like Candida albicans, Cryptococcus neoformans, Pneumocystis eurovici, and Aspergillus fumigatus. First, let us see about dimorphic fungi. They live in two forms at 25 degrees Celsius, that is in room temperature. They live as mold. A mnemonic to remember is in cold temperature they live as mold. At 37 degrees Celsius, that is at body temperature, they exist as yeast. A mnemonic to remember is at heat they will be yeast. Now let us see about tinea infections. Depending on the part of the body which they affect, they are called by different names. Tinea corporis affects trunk, Tinea cruris affects groin, Tinea capitis affects head, Tinea unguum affects nail beds, and Tinea pedis affects foot. It is caused by cutaneous fungi like Trichophyton, Epidermophyton, or Microsporum species. This picture shows a case of tinea or ringworm. It is treated with topical miconazole. Oral griseofulvin can be given for Tinea capitis and Tinea unguum. Now let us see a clinical case. 29-year-old athlete presents with a red pruritic skin eruption with an advancing peripheral creeping border on the forearm. Workup shows septate hyphae in KOH scraping. This is a classic case of Tinea corporis or ringworm. This picture shows KOH mount of tinea infections. You can see septate hyphae. Now let us see about Tinea nigra. It is caused by Pheoanulomyces wernicki or Hortae wernicki. It is treated with topical salicylic acid. This picture shows a case of Tinea nigra. This picture shows Hortae wernicki, which causes Tinea nigra. Now let us see about Tinea versicolor. It is also known as Pityriasis versicolor. It is caused by Malassezia furfur. There will be spaghetti and meatball appearance on KOH preparation. It is treated with topical miconazole or selenium sulfate. This picture shows a case of Tinea versicolor. This picture shows the spaghetti. This is spaghetti and this is the meatball appearance of Malassezia furfur on KOH preparation. Now let us see about Sporothrix schenki. It is a dimorphic fungus living on rose thorns and splinters. It causes rose gardener disease with ascending lymphangitis. It can be treated with potassium iodide and itraconazole. This picture shows ascending lymphangitis in a case of sporotrichosis. Now let us see about endemic mycosis, which can mimic TB. These include histoplasmosis, coccidioidomycosis, paracoccidioidomycosis, and blastomycosis. First, let us see about Histoplasma capsulatum. The organism is found inside macrophages. It can spread in pigeon and bat droppings. It is endemic to Ohio and Mississippi River valleys of United States. Now let us see a clinical case. 36-year-old man from Ohio presents with flu-like symptoms. On examination, there is fever and generalized lymphadenopathy. Chest X-ray shows bilateral hilar adenopathy. This is a classic case of histoplasmosis caused by Histoplasma capsulatum. This picture shows bilateral hilar lymphadenopathy, which can be seen in a case of histoplasmosis. Now let us see about blastomycosis. It is a big, broad-based, budding dimorphic fungus, as you can see in this picture. A mnemonic to remember blastomycosis is 5Bs. It is big, broad-based, budding blastomycosis. Now let us see about Coccidioides immitis. It causes San Joaquin fever or desert valley fever. It is endemic to southwest United States and California. It is treated with fluconazole and amphotericin B. Now let us see about paracoccidioidomycosis. It shows captain's wheel appearance on microscopy. This picture shows captain's wheel appearance of paracoccidioids. It is endemic to rural Latin America. Now let us see about Cryptococcus neoformans. It is urease positive. It stains with India ink and latex agglutination. It shows narrow-based unequal budding yeasts with capsular halo. It causes meningitis from pigeon droppings. It is treated with amphotericin plus flucytosine for 2 weeks followed by fluconazole. This picture shows gram stain of Cryptococcus neoformans, and this picture shows India ink stain of Cryptococcus neoformans demonstrating the capsule. Now let us see about Candida albicans. It shows budding yeast, pseudohyphae and germ tubes at 37 degrees Celsius under microscope. It can cause thrush in an immunocompromised patient. Thrush is treated with nystatin. It should be swished and swallowed. And if there is systemic infection, we have to give amphotericin B. Now let us see a clinical case. 31-year-old obese woman presents with pruritus in her skin fold beneath her pannus. Physical examination shows whitish curd-like concretions beneath the abdominal panicles. Workup shows budding yeast on 10% KOH preparation. This is a classic case of cutaneous candidiasis. This picture shows oral thrush caused by Candida albicans. This is a case of cutaneous candidiasis. This picture shows germ tube and budding daughter cell on KOH preparation in a case of candidiasis. Now let us see about Aspergillus species. It shows 45-degree angle branching and septated hyphae and fruiting bodies. This picture shows the 45-degree angle branching and septated hyphae along with fruiting borders in a case of aspergillosis. Aspergillus fumigatus causes fungus ball in lungs or invasive disease. It is treated with voriconazole. Aspergillus flavus contains cancer-causing aflatoxins. Now let us see a clinical case. 38-year-old man with history of asthma presents with recurrent fever, wheezing and cough productive of brown mucus plugs. Complete blood count shows eosinophilia, high IgE titers. Chest X-ray shows mucoid impaction of dilated central bronchi. This is a classic case of allergic bronchopulmonary aspergillosis. This picture shows chest X-ray of a case of allergic bronchopulmonary aspergillosis. Now let us see about Pneumocystis cerevisiae. It was previously known as Pneumocystis carinii. It shows flying saucer appearance of silver stain. This picture shows Pneumocystis cerevisiae in silver stain. It can cause interstitial pneumonia of the immunocompromised. It is treated with trimethoprim sulfamethoxazole. For prophylaxis, we can give pentamidine. Prophylaxis is indicated in AIDS patients with CD4 plus count less than 200 cells per millimeter cube. Now let us see about Mucor and Rhizopus species. They show wide angle, that is 90-degree branching of irregular non-septated hyphae, as you can see in this picture. Now let us see about Parasitology. First let us see about classification of protozoa. Protozoa can be classified in two ways. They can be classified as protozoa which cause gastrointestinal infection, urogenital infection and systemic infection. Protozoa which cause gastrointestinal infection are Entamoeba histolytica, Giardia lamblia and Cryptosporidium parvum. Trichomonas vaginalis causes urogenital infection. Protozoa which cause systemic infection include Toxoplasma gondii, Leishmania donovani, Trypanosoma cruzi, Trypanosoma brucei, Plasmodium falciparum, Vivax, ovale and malaria. Protozoa can also be classified as amoebas which move with pseudopodia like Entamoeba histolytica, sporozoans which are non-motile, and it includes Cryptosporidium parvum, Toxoplasma gondii and Plasmodium. Flagellates which move with flagella, and it includes Giardia lamblia, Trichomonas vaginalis, Leishmania donovani, Trypanosoma cruzi and Trypanosoma brucei. Ciliates which move with cilia like Balantidium coli. Remember, all protozoa are unicellular eukaryotes. Many protozoa can exist in two forms. The two forms are trophocytes and cysts. Trophocytes are the feeding or reproducing form found in favorable environments. Cysts are the protective or dormant form found in difficult environments. This picture shows trophocyte of Entamoeba histolytica. This picture shows cyst of Entamoeba histolytica. Now let us see about Entamoeba histolytica. It can cause bloody diarrhea with flask-shaped ulcers, liver abscesses, and trophocytes in stool. It is treated with metronidazole and iodoquinol. Now let us see a clinical case. 29-year-old man presents with high fever and right upper quadrant pain. Physical examination shows severe hepatomegaly and dullness over right lower lung. Abdominal CT shows large cavitating lesion in liver. This is a classic case of amoebic liver abscess. This picture shows CT scan of amoebic liver abscess. Now let us see about Giardia lamblia. It has pear-shaped binucleate and flagellated trophocytes, as you can see in this picture. It can cause flatulence, bloating, and foul-smelling diarrhea. It is treated with metronidazole. Now let us see a clinical case. 21-year-old presents with nausea, vomiting, bloating, and foul-smelling stools on returning from a camping trip. Workup shows binucleate flagellated trophocytes in stool. This is a classic case of giardiasis. Now let us see about Cryptosporidium. These are obligate intracellular parasites. Cysts of Cryptosporidium are acid-fast and they can be visualized on acid-fast stain, as you can see in this picture. They can cause severe watery diarrhea in AIDS patient. Treatment of cryptosporidiosis is supportive, that is hydration, and we have to improve immune status. Now let us see about Trichomonas vaginalis. It causes vaginitis with foul-smelling frothy discharge. It can be treated with metronidazole. This picture shows trophocytes of Trichomonas vaginalis. Now let us see about Toxoplasma gondii. It is transmitted by cysts in meat or cat feces. It can cause encephalitis with brain abscess in immunocompromised host and congenital defects. It can be treated with pyrimethamine and sulfadoxine or clindamycin. This picture shows tachyzoids of Toxoplasma gondii. Now let us see about Leishmania donovani. It is transmitted by sandfly. It can cause black fever or kala azar. Microscopy shows macrophages containing A mastigotes, as you can see in this picture. It is treated with sodium stibogluconate or pentavalent antibody. Now let us see about Trypanosoma brucei. It is transmitted by CC fly. It shows antigenic variation, that is Trypanosoma brucei gambians and Trypanosoma brucei rhodesians. It causes African sleeping sickness. It can be treated with suramin for acute cases or melarsoprol for CNS symptoms. This picture shows blood smear demonstrating Trypanosoma brucei. Now let us see about Trypanosoma cruzi. It is transmitted by redweed bug. It causes Chagas disease. Clinical features of Chagas disease include megacolon, megaesophagus, and cardiomegaly with apical atrophy. It is treated with nifurtimox. This picture shows Trypanosoma cruzi. Now let us see about Plasmodium. It is transmitted by female Anopheles mosquito. Blood smear can show trophocytes and schizons. Clinical features include cyclic fever, headache, anemia, and splenomegaly. Immune response bursts red blood cells that release merozoites. This leads to the cyclic symptoms in malaria. It is treated with chloroquine for erythrocyte forms and primaquine for latent forms of Plasmodium vivax and Plasmodium ovale. For chloroquine resistant malaria, we can give artemisinin combination therapy, mefloquine or quinine, and pyrimethamine or sulfadoxine for Plasmodium falciparum. Africans are resistant to Plasmodium vivax infection. This is because they carry sickle cell trait and they lack antigens Duffy A and B on RBCs. Now let us see about microscopy findings in a case of malaria. This picture shows trophocytes of Plasmodium vivax. This picture shows schizont of Plasmodium vivax. This is gametocyte of Plasmodium vivax. This is gametocyte of Plasmodium falciparum. This is ring form trophocyte of Plasmodium falciparum, and this is gametocyte of Plasmodium falciparum in thick smear. Now let us see about Babesia. It shows Maltese X cross shape in blood smear, as you can see in this picture. It causes fever and hemolytic anemia after Ixodes tick bite. It is treated with quinine and clindamycin. Now let us see about helminths, which are multicellular parasites. They can be divided into nematodes or roundworms and platyhelminths or flatworms. Adult form of nematodes are non-segmented with complete digestive tube from mouth to anus. Examples include Ascaris lumbricoides, Enterobius vermicularis, Trichinella spiralis, Strongyloides stercoralis, Necator americanus, Ankylostoma duodenale, Onchocerca volvulus, and Wuchereria bancrofti. Platyhelminths, that is flatworms, can be divided into cestodes or tapeworms and trematodes or flukes. Adult form of cestodes are segmented with scolex and proglottids. Examples include Tinea saginata, Tinea solium, and Echinococcus granulosus. Adult form of trematodes are non-segmented with incomplete digestive system. In some species, females reside within grooves, that is cysts of males. Examples include Schistosoma species. Now let us see about hookworms in detail. It includes Ankylostoma duodenale or Necator americanus. The larva penetrate skin of feet. It causes GI infection leading to anemia. It can be treated with mebendazole or pyrantel palmate. Now let us see about life cycle of Ankylostoma duodenale. As you can see, the filariform larva penetrates skin. It causes gastrointestinal infection, and there will be adults in small intestine. There will be eggs in feces, which is the diagnostic stage. Rhabditiform larva hatches from the eggs. They grow into filariform larva. The filariform larva penetrates skin, which is the infective stage. Now let us see about Loa loa. There will be worms visibly crawling in conjunctiva. In case of Loa loa, this picture shows Loa loa crawling in conjunctiva. It is spread by deer fly. It is treated with diethyl carbamazine. Now let us see about Trichinella spiralis. Clinical features include fever, periorbital edema, and myositis after ingesting raw pork. It is treated with thiabendazole. This picture shows Trichinella spiralis in muscle. Now let us see about Onchocerca volvulus. It causes river blindness. It is spread by female black flies. It is treated with ivermectin. A mnemonic to remember this is ivermectin is given for river blindness. Now let us see about Wuchereria bancrofti. It causes elephantiasis from lymphatic blockage. It is treated with diethyl carbamazine. This picture shows Wuchereria bancrofti. Now let us see about Strongyloides stercoralis. It is also known as threadworm. The larvae penetrate skin and it can cause autoinfection. It will lead to gastrointestinal infection and cause strongyloidiasis, which includes skin symptoms, abdominal pain, diarrhea, and weight loss. It is treated with thiabendazole or ivermectin. Now let us see about Enterobius vermicularis or pinworms. It causes intestinal infection and anal pruritus. There is increased incidence in children. It shows positive tape test. It is treated with mebendazole or pyrantel palmate. Now let us see a clinical case. 6-year-old child with poor hygiene presents with complaints of severe perianal itching, that is worse at night. On workup, a Scotch tape test reveals eggs visualized under the microscope. This picture shows eggs of Enterobius vermicularis. Now let us see about Toxocara canis. It is also known as dog roundworm. It can cause granulomatous hepatitis and chorioretinitis. It is treated with diethyl carbamazine. Now let us see about Ascaris lumbricoides. It causes gastrointestinal infection. It competes for food and it can lead to malnutrition in children. The eggs are visible in feces. It is treated with mebendazole or pyrantel palmate. This picture shows fertile egg of Ascaris lumbricoides and this is an infertile egg of Ascaris lumbricoides. Now let us see about Paragonimus westermani. It can cause inflammation and secondary bacterial infection of lungs. It is acquired due to undercooked crab meat. It is treated with praziquantel. Now let us see about Opisthochus sinensis or Clonorchus sinensis. It can cause biliary tract inflammation from undercooked fish. It is treated with praziquantel. Now let us see about Taenia solium. It is acquired due to undercooked pork. The undercooked pork larval form can cause mass lesions in brain. This is known as cysticercosis. This picture shows development of cysticercosis. As you can see, it is due to eating undercooked pork larval form. It is treated with praziquantel or niclosamide. Albendazole should be given for cysticercosis. Now let us see about Echinococcus granulosus. It causes hydrated liver cysts. It is acquired due to eggs in dog feces. It can cause anaphylaxis if antigens are released from cysts. It is treated with albendazole and careful surgical removal of cysts. The cysts are pre-injected with ethanol. Now let us see about Diphyllobothrium latum. It is also known as fish tapeworm. It causes vitamin B12 deficiency. It is treated with praziquantel. Now let us see a clinical case. 33-year-old Northern European with history of eating raw fish, presents with shortness of breath and weakness. Workup shows megaloblastic anemia and operculated eggs on stool examination. This is a classic case of Diphyllobothrium latum. This picture shows fertilized egg of Diphyllobothrium latum. The eggs are ovoid. There is an operculum at one end and a knob at the other end. Now let us see about Schistosoma species. Cercariae of Schistosoma penetrate skin, leading to granulomas and inflammation of liver and spleen. This picture shows Schistosoma japonicum eggs in hepatic portal tract. Snails are hosts of Schistosoma species. It is treated with praziquantel. Now let us see about Schistosoma hematobium. It is the fluke associated with squamous cell carcinoma of urinary tract. It is also treated with praziquantel. Eosinophils are elevated in helminth infections. The most common helminth infection in developed countries is Enterobius vermicularis. Now let us see about some important adverse drug reactions of antiparasitic drugs. Chinchonism is caused due to quinine. The clinical features of chinchonism include tinnitus, blurred vision, dizziness, nausea and vomiting. Hemolytic anemia can be caused in glucose 6-phosphate dehydrogenase deficient persons due to chloroquine, primaquine, quinine and trimethoprim sulfamethoxazole. Now let us see about Masuti reaction. Clinical features include pyrexia, hypotension and respiratory distress. It is caused by death of parasites. It occurs when onchocerca infection is treated with diethyl carbamazine. Now let us see about immunology. First let us see about cells of the immune system. They are derived from hematopoietic stem cell. They can be divided into lymphoid lineage and myeloid lineage. The lymphoid progenitor gives rise to B cell progenitor, natural killer cell and T cell progenitor. The B cell progenitor gives rise to memory B cell and plasma cell. The T cell progenitor gives rise to memory T cell, cytotoxic T cell and helper T cell. The myeloid progenitor can give rise to neutrophil, mast cell, basophil, eosinophil and monocyte. The monocyte can give rise to dendritic cell and macrophages. Now let us see about the cells of the immune system in detail. Innate immunity involves monocytes, macrophages, neutrophils and natural killer cells. T lymphocyte is involved in cell mediated immunity and transplant rejection. T helper cell recognizes antigen presented in the context of MHC class II molecules. It is also major source of interleukin 2 production, specifically Th1 cells. B lymphocyte is involved in humoral immunity. Plasma cell is the antibody producing cell with abundant rough endoplasmic reticulum. Now let us see about neutrophil. It is the primary phagocytic cell in acute inflammation. It contains myeloperoxidase and lysozyme. It demonstrates a multilobed nucleus in vitamin B12 or folate deficiency. And let us see about mast cell. It is a major mediator of type 1 hypersensitivity reaction. Granules of mast cell contain histamine and heparin. Now let us see about basophil. It expresses IgE receptors on cell membrane to mediate allergic response. Granules of basophil also contain histamine and heparin. Eosinophil is the major mediator of the antiparasitic response. It is increased in atopic asthma. Macrophage secretes interleukin 1 to promote T cell activity. It expresses high levels of MHC class 2 on its cell membrane. The precursor of macrophage is monocyte. Now let us see about major antigen presenting cells in tissues. It includes macrophages, dendritic cells and B cells. Now let us see about immunoglobulins. There are 5 classes of immunoglobulins. They are IgG, IgM, IgA, IgE and IgD. IgG is the most abundant immunoglobulin. It is able to fix complement. It is able to cross placenta and it is involved in long-term immunity. This picture shows IgG. It is a monomer. IgM is the first immunoglobulin produced on exposure to antigen. It is also able to fix complement. It is a pentamer. This picture shows IgM. As you can see, it is a pentamer. IgA is present in lining of mucous membranes and in secretions like breast milk and saliva. It is a dimer. This picture shows IgA. As you can see, it is a dimer. And let us see about IgE. It is elevated in patients with asthma and allergies. It causes mast cells and basophils to release histamine when triggered by antigen. The total levels and concentration of IgE can be estimated using radioimmunosorbent test, that is RIST, or radioallergosorbent test, that is RAST. This picture shows IgE. It is a monomer. IgD is embedded in the cell membrane of developing B cells. This picture shows IgD. It is also a monomer. Epitope is the portion of a molecule that serves as an antigenic determinant. And let us see about hapten. It is a small molecule that can serve as an antigenic determinant only if it is attached to a larger carrier molecule. Disulfide bonds link heavy and light chains of immunoglobulins, as you can see in this picture. When papain digests an immunoglobulin, there will be 2 FAB fragments, each capable of binding antigen, and 1 FC fragment. This picture shows papain digestion of an immunoglobulin. As you can see, there are 2 FAB fragments and 1 FC fragment. When pepsin digests an immunoglobulin, there will be 1 FAB-2 fragment and 1 FC fragment. This picture shows pepsin digestion of an immunoglobulin. As you can see, there is 1 FAB-2 fragment and 1 FC fragment which will also be digested. Now let us see about hypervariable region. It is also known as complementarity determining region, or CDR. It determines antigen specificity. Now let us see about mechanisms by which antibody diversity is created. It is created by mutations in the genes encoding CDR region. Other mechanisms include random VJ recombination in light chains, random VDJ recombination in heavy chains, random assembly of light and heavy chains, and imperfect recombination of VDJ genes. In this, V stands for variable, D stands for diversity, and J stands for joining. Now let us see about T cells. First let us see about T lymphocyte cell surface proteins. Alpha beta T cell receptor, that is alpha beta TCR is the antigen specific receptor on 95% of T cells. Gamma delta TCR is the antigen specific receptor on 5% of T cells. Now let us see about CD2. CD stands for cluster of differentiation. It is the cell surface protein on immature T cells. CD4 responds to MHC class 2 molecule expressed by antigen presenting cells. It is found specifically on T helper cells. It is reduced in AIDS. Now let us see about CD8. It responds to MHC class 1 molecule expressed on all cells. It is found specifically on cytotoxic T cells. CD8 destroys virally infected cells. Now let us see about HLA haplotypes, that is human leukocyte antigen haplotypes. Ankylosing spondylitis is associated with HLA B27. Multiple sclerosis is associated with HLA DR2. Type 1 diabetes mellitus is associated with HLA DR3 or DR4. Rheumatoid arthritis is associated with HLA DR4. Abacavir hypersensitivity is associated with HLA B star 5701. Now let us see about cytokines. These are broad and loose category of small proteins. They are around 5 to 20 kilodaltons and they are important in cell signaling. Now let us see about the various cytokines. Interleukin 1 is produced by macrophages. It is an endogenous pyrogen. It induces interleukin 2 production by T cells. It induces B and T cell activity during the initial stages of an immune response. Interleukin 2 is produced by T helper cells. It activates T helper, T cytotoxic, natural killer and B cells. Interleukin 3 is secreted by activated T cells and it induces maturation of bone marrow stem cells. Interleukin 4 is produced by T helper cells. It induces production of IgE and IgG. It inhibits production of interferon gamma. Now let us see about interleukin 5. It is produced by T helper cells. It promotes IgA synthesis. It induces differentiation of eosinophils and promotes growth in B cells. Now let us see about interleukin 8. It is produced by monocytes and endothelial cells. It is a chemotactic factor for neutrophils. Interleukin 10 is produced by Th2 cells. It inhibits production of interferon gamma by T helper cells and it inhibits differentiation of Th1 cells. And let us see about interleukin 12. It is produced by macrophages and B cells. It stimulates Th1 differentiation. It promotes production of interferon gamma by T helper cells. Now let us see about transforming growth factor beta or TGF beta. It inhibits growth and function of T and B cells and promotes collagen secretion during tissue repair. Now let us see about tumor necrosis factor alpha or TNF alpha. High concentrations of TNF alpha induce cell death in some tumors and cause cachexia. Low concentrations promote neutrophil activity and interleukin 2 receptor expression. Now let us see about Gell-Coombs classification of hypersensitivity reactions. Type 1 hypersensitivity reaction is also known as immediate or anaphylactic hypersensitivity. It is mediated by IgE bound to mast cells and basophils. It occurs in response to environmental allergies. It is associated with the release of histamine, platelet activating factor, leukotrienes, prostaglandins and thromboxanes. Examples for type 1 hypersensitivity reactions include asthma, drug or environmental allergies and systemic anaphylaxis. Type 2 hypersensitivity reaction is also known as antibody mediated cytotoxic reaction. In this, there is binding of cytotoxic T cells or complement to Fc portion of antibody which causes target cell lysis. Examples for type 2 hypersensitivity reactions include erythroblastosis fetalis, Lambert-Eaton syndrome, myasthenia gravis, pernicious anemia, rheumatic fever, Goodpasture syndrome, Graves' disease, hemolytic anemia, and transfusion reaction due to ABO incompatibility. Let us see about type 3 hypersensitivity reaction. It is also known as immune complex reaction. In this, there is immune complex deposition in tissues resulting in an inflammatory response. Examples for type 3 hypersensitivity reaction include Arthur's reaction, rheumatoid arthritis, serum sickness, immune complex mediated glomerulonephritis, and systemic lupus erythematosus. Now let us see about type 4 hypersensitivity reaction. It is also known as delayed type hypersensitivity. Antigen sensitized T cells release cytokines which induce an inflammatory response up to 48 hours after initial contact with antigen. Examples for type 4 hypersensitivity reaction include chronic transplant rejection, contact dermatitis, reaction to poison ivy, multiple sclerosis, and tuberculin skin test. Now let us see about complement system. It is part of innate immune system that enhances, that is, it complements the ability of antibodies and phagocytic cells to clear microbes and damaged cells. Gram-negative organisms are particularly susceptible to complement mediated lysis. IgG and IgM isotopes activate the classic pathway of the complement cascade. Aggregated IgA, endotoxin, and other components of the bacterial cell wall activate alternative pathway of complement cascade. Now let us see about some important components of the complement cascade. C1 to C4 are involved in neutralization of viruses. C3b plays a role in opsonization, as you can see in this picture. C5a is involved in neutrophil and macrophage chemotaxis, that is, it is involved in inflammation, as you can see in this picture. C5b to C9 are involved in synthesis of membrane attack complex, as you can see in this picture. Formation of C3 convertase is by C4b and C2b in classic pathway, as you can see in this picture. In alternative pathway, it is by C3b and BB, as you can see in this picture. Now let us see about deficiency of complement components. Hereditary angioedema can occur due to deficiency of C1 esterase inhibitor. Sinus and upper respiratory tract infections can occur due to deficiency of C3. Recurrent Neisseria infections can occur due to deficiency of C5b to C9. Paroxysmal nocturnal hemoglobinuria can occur due to deficiency of decay accelerating factor. Now let us see about various types of grafts. Autograft is graft from self. Isograft or syngenic graft is graft from identical twin or clone. Allograft is graft from same species. And xenograft is graft from different species. Now let us see about various types of transplant rejection. Hyperacute rejection occurs in minutes to hours. It is due to preformed antibodies in host that react against graft antigens. Accelerated rejection occurs in hours to days. It is due to activation of previously sensitized T cells. Acute rejection occurs in days to weeks. It involves T cell activation, differentiation, and antibody production. Chronic rejection occurs in months to years. It is due to immune complex deposition combined with subacute cell cytotoxicity. Now let us see about MHC molecules, that is major histocompatibility complex molecules. The activity of cytotoxic T cells against tumor or virally infected cells requires MHC class 1 cell surface receptor for antigen presentation. The activity of cytotoxic T cells against pathogens phagocytosed by macrophages require MHC class 2 cell surface receptor for antigen presentation. That is, for tumors and virally infected cells, we require MHC class 1, and for other pathogens phagocytized by macrophages, we require MHC class 2. If you have any suggestions, please let me know in the comment section. This is just a review video of microbiology. I have made separate videos on important topics. You can check them out in the microbiology playlist. If you like my videos, kindly subscribe. Your subscription will encourage me to make more videos. Thank you.